everyone, and welcome to Culture Focus Magazine. We are pleased to have with us nurse practitioner Lequawan James, who is also a coronavirus survivor, and he will be discussing his experience as a patient, also as a practitioner, and imparting some of his wisdom and helpful tips, guidance that may help you and someone that you are caring for with the virus, as well as explain his experience, the role that mental health played in helping him get through the virus itself. So let's get started. So Lequawan, can you explain a little bit about your symptoms?
For me, at first, I thought symptoms had to do with pollen. I had just a little runny nose, no fatigue, any of the sorts. And so I took Claritin. Things got a little bit better. I took Mucinex and things like that. And then around 6 days later, I woke up in the middle of the night with fever, chills. I was freezing despite having 2 quilts on me. And, I have 8 years of ER experience as a nurse. So I wasn't going to play around. I got up the next morning and I went straight to the ER and told them that I wanted to get tested for COVID-19. And they meet you at the door. They greet you, ask you, hey, have you traveled outside the U.S. in the past 2 weeks? I said no. And then they took me to triage to get my temperature checked. And then I also received a chest x-ray as well. And at the time, my temperature was 104. I knew I had a fever, but I didn't know I was burning up that much.
Wow.
And so after that, it was determined that I had pneumonia in both lung bases, which is an inflammation of both lung fields, which means I had difficulty breathing. So with having the fever and having the pneumonia, they treated me as I had pneumonia, which was with antibiotics and fluids. And also that time, they did the nasal swab on me to detect if I had flu. And if that was negative, then they sent it off to get tested for COVID-19. Fun fact is my nasal swab came back as negative for COVID-19, but my mucus that I was coughing up came back positive for COVID-19.
Ah, interesting.
Yeah, that happened to me and another person that I know of closely, that they were also had the same thing happen to them.
Okay, any background as to why, or that you know?
Well, from my understanding, at that time, I was told that the nasal swab was 60% accurate,
Okay.
but the mucus confirmed it.
Ah, okay. Thank you for explaining that a little bit better, because it's important for our viewers to hear that, because initially, we were hearing from the CDC that this was an older person's, people with older would get the virus. Basically, the implication was that, younger folk didn't have anything to worry about. And it's quite the opposite, because
definitely
active before.
definitely. Yeah. I work out 6 days a week. I just had a physical a month ago, and that was normal. I'm as healthy can be. I haven't even had a cough in 9 or 10 years.
Oh, wow.
So for this to come out of nowhere and affect me the way it did, it was unheard of. And so the things that I experienced in the hospital, which led me to go to the ICU, was I had a fever for multiple days, was not being touched by medications.
Okay.
I ended up having to be on a breathing mask and still had problems there. I had developed an enlarged heart from COVID-19. I developed a migraine, and even with just standing up, I lost my breath, because I stood up because I was trying to walk to the bathroom. So I had to take the oxygen off to do that because it wouldn't extend. The bathroom was literally 4 feet away, and I was short of breath walking 4 feet away. And you're talking about somebody that works out vigorously 6 times a week. I couldn't walk 4 feet without oxygen.
Wow. So really, as they say, takes the wind out of you, like
It does.
literally. And so, as you talk about the symptoms and things that you had for your normal person, when should they go to the hospital then? When they, can you tell us and explain a little bit more?
For a normal person, it's just anything out of the ordinary.
Mm-hmm.
If you start to feel short of breath with minimal activity, you notice a fever, you start to have shakes or chills or fatigue, any of those symptoms can result and you need to be seen because from what I've seen with this disease,
Mm-hmm.
is that once you start to exhibit those type of symptoms, it can progress a lot faster in 24 hours because that's what happened to me and some other people that I know whose family members, they progressed in 24 hours to something far worse.
Okay, so if mild symptoms, that's one thing.
Hmm.
Start, the intensity
Correct.
grows.
Correct.
Okay, you recommend. Thank you, thank you.
Hmm.
And then, as far as Tylenol versus ibuprofen treatment itself, you've talked about how and when in the hospital, what you received. For people that are at home,
Hmm.
what do you recommend initially?
Tylenol was the thing that worked most.
Mm-hmm.
With the ibuprofen, it could make things worse based off how the drug is manufactured.
Uh-huh.
Therefore, Tylenol is what they prescribe for people with any headaches. Even with migraines, I had a Furacet that had Tylenol in it.
Okay.
So even when I had the migraine, they still didn't give ibuprofen or Motrin, any of those medications.
Okay, so that's important for people to know because in reading, some may have heard about ACE inhibitors and meds that may make things worse. So thank
Mhm.
you.
Because a side effect of an ACE inhibitor,
Mhm.
it can make your cough even worse.
Okay,
Mhm.
okay, critical to know. Then, as far as clinical trials, we're hearing a lot around treatment, and there's this race to find the answer, obviously. What is your impression of those for our viewers?
So I
Mhm.
looked into that too after I got out of the hospital. Is Plaquenil and azithromycin, the antibiotic.
Mhm.
And so from what I read from the clinical trials, it said that a patient in China after 9 days of treatment, they had gotten a lot better.
Mhm.
But then also too, if someone has cardiac issues, then you don't want them to have those two medications because it can cause arrhythmias.
Mhm.
So yeah, that it could work for some people, but if there's a lot of people who are older
Mhm.
who have the disease, a lot of them already have cardiac issues. So you wouldn't want to treat them with that anyway.
Mhm. Mhm.
And so but when I was in the hospital, they only managed symptoms. But at the same time, I was intubated for 4 days, which means there's a tube down my throat. I was supposed to be sedated and so basically shutting down your body and the tube breathes for you. So
Mhm.
because of that, after the tube came out, my body healed itself tremendously by the time I got discharged. My heart went back to normal size. I was able to breathe on my own.
Okay.
All those things happened after being shut down for 4 days and then being rejuvenated
Ah.
per se. But after that, I healed fast. And my doctor said I was like the talk of the hospital because I healed so fast despite almost dying.
Wow. Well, and we hear a lot about, being intubated and put on a ventilator. Did that scare you initially when you were told?
Oh, definitely.
Mhm.
At that time, that's when I knew I was really, really sick.
Mhm.
And I was very scared. And the whole time that you're in the hospital, you're by yourself. You're not allowed to have visitors.
Mhm.
So before I got intubated, the doctor allowed me to call my family
Oh,
who are 4 hours away
wow.
to tell them,
Mhm.
hey, I got worse.
Mhm.
I'm going to be intubated. I had to explain to them what that was.
Mhm.
And then I said, I'm not sure how long I'm going to be sedated or if I'm even going to wake up. So that was a extremely hard conversation to have. I couldn't talk without crying because
Yes,
I
yes.
was scared, they were scared, and the fact that you can't have visitors and they're 4 hours away, like you're pretty much waiting to hear, did my son make it? Did my son die? Like, I can't imagine what other families are experiencing, knowing that that's what they have to go through. And with me, with my prior experience as an ER nurse, you know, with intubation, you may be asleep for 7 days, 3 days, 2 weeks, or you may not make it. So those thoughts, all those thoughts ran through my head, and I was extremely terrified. And the time that I was in the ICU, I was awake and intubated because my resting heart rate is so low that this sedative medication will bring it down too low into critical ranges. So they had to give me the lowest dose possible and just to keep me there. But I was awake the entire time. That's why you were able to see me take a picture of myself while intubated.
Okay. Okay.
Yeah. Because at that time, I knew if I made it out of here, that I was going to do all I could to educate people that it's not a disease for the elderly. It's a disease for all. I've known a 6-year-old to pass away, an infant to pass away, a 35-year-old with asthma but otherwise healthy to pass away. No one is bulletproof. I don't care how healthy you are. And that's what my main message is to a lot of my followers, along with African Americans specifically, because 51% of the COVID deaths are African American. And that is just crazy. That is insane. And that's why I'm spending a lot of time trying to educate African Americans as to what is going on, because a lot of them need to be informed.
Yes. Yes.
A lot of them need to be informed. And with things opening up now as well, Georgia's opening up a lot of things. And I don't agree with it at all, because I don't want more people to end up like I was or worse. Yeah. You know, I understand that, you know, there's a time when people need money, but this is the analogy that I say. Okay, I understand it's hard to close a business for 4 to 5 weeks, but it's even harder to close a casket for forever. And that's exactly what I'm explaining to people about, oh, we need money, all this other stuff. And I'm just giving them that analogy to put things into perspective.
Yes, that's a very important message. And one of the reasons why we wanted to have this focus on health around the coronavirus, this topic certainly is very appropriate for the period. Now, you mentioned, you know, getting to call your parents and your family, basically, to let them know what was going on. And we've heard in the news, you know, of some nurses also putting the phone to the patient's ear to help them. What are your thoughts behind that as far as those critical moments to allow that one-to-one time with the patient and their family before, who knows, maybe they will come out of this, maybe they won't. So
I feel like that should be necessary, because we all know everyone is scared, even the nurses themselves. Like, you could see the fear in nurses, because I was in a hospital in the early stages of when this disease happened. So you could see that a lot of nurses were scared because they had the fear of the unknown. And I was the same way. Luckily for me, I had my cell phone, but I can't say for the older generation that they might have had their cell phones or things like that. So that one phone call may be like the best feeling ever for them. And that could actually help them make it through.
Exactly. And I think that's important to know for not only the patients themselves, for them to ask and advocate for that if they can, obviously, before they take a turn for the worse. Or certainly practitioners, clinicians, you know, because you've now come through, so to speak. And like you said, it's important to educate not only the lay public, but then also fellow practitioners as well around your experience. You've touched on, because one of the things I was going to ask you was, yes, nurses, clinicians coming into the room, and that fear, not only for them, you know, the virus itself, a patient, you know, that is impacted by the virus, but then also, you know, what are they going to take home, you know, to their family. So it must have been absolutely terrifying for both them and you. You've touched on race. That was another question that I was going to ask you. Just the impact for minority groups, African Americans, other minority groups as overall, in the warnings. You know, why do you think perhaps the groups, certain groups, certain individuals aren't taking this as seriously as they should?
The fact is because people think they are invincible. They think because I live in a certain area that I may not get it. I'm in an area where there's less numbers. I may not get it. But that's not what we're saying here. And all while being in school, you learn that African Americans are more susceptible to a lot of comorbidities. And with a lot of things opening up, this is a time that a lot of patients, no matter what race you are, if you have any comorbidities, you need to be compliant with your medication regimen. If not, that could be the result of you living or dying if you contract this disease. And while being an ER nurse, a lot of my patients that were African American, a lot of it, their problems were due to medication non-compliance. And so at this time, if you're going to be out there with things opening up, you need to make sure you wear a mask. You need to make sure you're 6 feet or more away, because it was found that people should be about 12 feet away. Or with the disease itself, if someone sneezes, it travels up to 27 feet as well as 48 miles per hour.
Wow.
Exactly. So you could have walked away. Someone could have sneezed. You're not wearing a mask, and the wind is blowing towards you. Them 27 feet away, you could have the virus.
Wow.
So I feel like people need to know those facts. And even with the gyms opening, like in Georgia, I did some research. So on gym equipment alone, there's over 600 different bacteria and viruses on gym equipment.
Whoa.
Yes. And I feel like people need to know that, because you have to be careful. This now is a time more than ever to be careful. And there's another thing that I want to point out. One of my dear friends, he is very educated, very healthy. He was a COVID survivor himself. He got a letter to donate plasma, because that's one of the things that they're trying to do to help cure patients. However, when he called the number to say, yes, he's interested, so I guess they did some research on him, and they found out that he was gay. So they told him that he couldn't donate plasma because of being gay.
Oh, wow.
Yes. And
common knowledge. I have not read that myself.
Yes. And I, questioned him about it. And I said, did they tell you why? He said, it's basically because I'm gay. And this guy is very educated. Even someone named Andy Cohen, he's a talk show host. Same thing with him. We're at a point in the world today where we're trying to save people. You have time to discriminate against someone who's healthy and gay?
Totally. We need blood, plasma, everything.
Yeah. I'm just like, they're trying to do their own due diligence to save someone.
Exactly.
And you are eligible based off being healthy. Over the age of 17, have previously tested positive for COVID-19, and have been symptom-free for at least 14 days. Nowhere in this for the FDA says anything about you being gay, but he finds that out when he calls, and they tell him because he's gay, he can't donate plasma. That is crazy. At a time where we need anything we can to save someone. You find time to discriminate. It's beyond me. But
on deck. All hands on deck is what we need.
Exactly.
Across the nation. And so it's a thank you for sharing that, as those experiences, as well as like gym equipment, how long the virus survives in settings like that, subways for in certain sections of the country, other public places, boxes, deliveries from Amazon, or, different different places where the virus may survive for longer periods of time. People need to be aware of that, especially if their governors of certain states are advocating going back before some believe.
Because
Really,
yeah, because the coronavirus can stay on surfaces for up to 4 hours. It can stay on cardboard boxes for up to 24 hours. So with that knowledge, I'm telling people, if you are ordering things that are being delivered in boxes, I would highly recommend you wipe those boxes down or open your box outside and then bring whatever's in there inside. But I would still wipe that down as well.
yes, yes.
If you are taking care of someone with the virus, you should wear a mask at all times. Try not to be outside more than you need to. And
Yeah.
the people who work in the hospital, if you have a basement or something like that, or a hamper outside, I would try to take my clothes off as soon as I walk through the door, shoes, everything, put them in the hamper, because you don't want to have anything on you, because they can be on clothes as well. So
Yeah.
people really need to pay attention to those little things that we may not pay attention to that could have the virus on there.
Yes, yes. And what about male versus female? Is there any research on that you're aware of, that one sex has a greater propensity to getting the virus than others?
From what I saw, it looked like males had just the upper hand in contracting the virus than females, but I'm not exactly sure how that was proven. But I mean, it doesn't, for me, it's your comorbidities. It doesn't matter. Obese,
Yes.
asthma, diabetes, hypertension, any of the COPD, those are the people, no matter what race or ethnicity, that's what's happening. So
Exactly. And I think it's important to touch on, as you have, not only race, but the socioeconomic factors that play a role. Low education, low income often equals poor health outcomes, as we've touched on. And so you were speaking to, as you get home, for those that are coming from work, taking their clothes off at the door, making sure that they're wearing a mask. For certain people that aren't able to, live in spacious homes, they're in more crowded spaces like New York, where the family is on top of each other, like literally, for socioeconomic reasons. Don't live in a palace or 2,000 square foot home or anything like that. So I think some of what you were touching on is important for those viewers to hear. And perhaps you have some other tips for those that are living in cramped apartments, things that they can do perhaps in the apartment.
I would recommend pretty much cleaning, washing hands. And a lot of times I've seen that people who do live together genuinely, if they don't have any symptoms at all the whole time, then they should be okay. But if someone does start to develop symptoms, then I would recommend kind of like a little quarantine, where if they have their own room, I would put them in a room and help them with, hey, bringing them their food, making sure you wash and clean things, and kind of let them stay in the room until they get better. And that's the best thing you can do for if someone does have mild symptoms and you stay in close proximities.
Okay. Makes perfect sense. And then you touched on preventative measures as we move on, such as the hand washing, certainly wearing a mask, as we've heard of, social distancing. Any other helpful tips that you are hearing in your practice, even anecdotally, that is working for patients? Anything else off the top of your head that you can think of?
You want to wash your hands as much as possible.
And you said
Anything you
wash
touch, you're
your
gonna,
hands.
yes,
There's for how long?
30 seconds. You
30.
can actually sing the happy birthday song, and
Mhm.
that's about 30 seconds.
Okay. Okay.
hmm That's why I tell the kids that I see, wash your hands, sing the happy birthday song, and by that time, it's okay to dry your hands off.
Okay. Okay. Great advice. And then going through this entire experience, how do you think it has helped you in your care of patients? And what role did mental health and perhaps faith play in your ability to get better?
So after I got out of the hospital,
Mhm.
I received a lot of messages from people who knew someone or currently have someone that has the virus. And
Mhm.
so they asked, how do I get through this?
Mhm.
And that was the same question I had while in the ICU. Because I often question, if I pass away,
Mhm.
what do I like? I don't know, So all you can do is turn towards your higher power,
Mhm.
have faith, and just let that do its work. And I can't tell you that I was not depressed at all. I was completely 100% depressed in there because you don't have any family there, you're alone, and the thought of dying by yourself, that is just, there's no word can describe what that does to you mentally. But one thing that I turned to was I've always been one who worked hard to get where I am today, even with playing college sports and being an NP, a nurse practitioner today. Like I had to work my butt off to get those things because I did not come from a family with money or grew up in a big 5-bedroom house. None of that
Yes.
is what I have. So I took that type of motivation to keep myself strong while in there. And that's how I've been doing today, even after I got out of the ICU. It took that kind of strength. You have to learn how to breathe again because you wasn't able to breathe. I had to learn how to walk again because it had been 10 days since I've been out of bed. And I was malnourished already and I was so weak.
Mhm.
It was debilitating of how weak I was.
Mhm.
So I had to daily practice getting up by myself, taking a step by myself.
Yes.
And that is the same way that you have to have faith. Like you just have to have faith and believe in yourself. And that's all I had with me at the time because you don't have anyone else to motivate you.
Mhm.
You just have to say, I'm going to make it out of this. And if I do, and when I do,
Yeah.
I'm going to tell my story to advocate for other people before this even affects them.
And are there breathing exercises um, that you would recommend? I was doing some research in preparation. I believe in the UK, there was some information around particular breathing exercises that would help patients recover faster, so to
Mhm.
speak, or spirometry.
Yes. So that's what I use. The
Mhm.
incentive spirometer, what it does is it expands your lung fields.
Okay.
So typically people who have a diagnosis of pneumonia,
Mhm.
that's one of the first things you try to get them to use as soon as they are admitted to the hospital is they do a couple rounds of that
Mhm.
every couple hours because that helps with your lungs. And I did it even after I got discharged to help with my lungs. And then as you do that, you're training your lungs again, and then you're able to start walking,
Mhm.
then walking faster and taking breaks, then jogging. And
Mhm.
then now, like me, I'm back in the gym full throttle.
Now, fantastic, fantastic. So that's awesome. Congratulations on that. Back to
And let
your,
me point this out. When I say gym, it's my gym that I made in a storage unit, not the LA Fitnesses or the gyms that you know of. It's my own personal gym.
yes, yes, exactly. Safety first, for sure. And so you touched on it, your personal determination. Um, so explain why you chose to become a nurse practitioner as we transition into more, about you, just as a person and your faith and your background. What made you choose this as a profession?
Ever since I was a kid, I've always wanted to help people. I remember when I saw a homeless person for the first time, never saw it before, and I questioned my mom. I was like, "What's wrong with them? Why are they that way?" And she told me, were homeless and, they didn't make it.
Oh,
And I told her, I said, I wish I could help them.
mm,
And another instance was my grandma has diabetes, and I always kept her compliant because I wanted to prick her finger and give her insulin. I thought that was like the best thing ever. So I knew from then on that healthcare is what I was meant to do because I've always cared for people. Like I would give someone the shirt off my back or my last dollar because that's just who I am, and I've always been that way.
oh,
So, but now, even after all this happened, I question what my purpose was because I felt like I was a really good nurse practitioner.
mhm,
I took great care of all my patients. But after all this happened, what is my purpose now?
mm,
So I feel like my purpose now is advocating.
yes,
And this way I can save tons of lives indirectly by sending a message rather than physically with medications or seeing them in person or with touch.
yes, yes, exactly. Not always a pill.
Exactly.
Sometimes it's, um, imparting that knowledge and that firsthand experience with people directly. An important message, just overall. What is next then for you? What types of upcoming projects do you have forthcoming that you'd like to share with us?
So what I've started was I twice now I have got masked and I have driven my car around the Atlanta area giving masks and food to the homeless
Oh,
because I know a lot of them, just like African Americans in these areas where there's either they don't have insurance or there's less access to medical care, and it's the same for the homeless. So
hmm,
I was trying to do
ah,
what I wanted to do was give them a mask and give them some food because it's hard for them as well.
oh yes.
So I've done that twice as well. I've also done some volunteering with talking with retired vets and retired professional athletes who have struggled with substance abuse and mental health issues after being reintroduced back into the world after retiring from both the military and professional sports.
Mm,
So that's been very rewarding. It's called Merging Vets and Players. And just hearing their stories, it just lays on your heart, because even this is affecting them because they're used to being active. And a lot of people who even aren't vets or retired professionals, when you're used to being so active to now doing nothing,
yes,
this has happened,
yeah,
there's been an increase in depression and anxiety, an
yeah,
increase in suicides, and also an increase in substance abuse. So that's why, with that message, I've been telling everyone I can, anybody family member, friend, take the time to call them, check on them, see how they're doing, tell them you love them because that's the one thing they need right now that can get them through the next day.
yes, yes, exactly. Anyone going through this.
Anyone, even myself, when once I got out of the hospital, it was very hard just sitting in this apartment by myself.
Mm-hmm.
And I wasn't strong enough at that time, so I really had to rely on myself
Mm-hmm.
to get around to make something to eat or like it was hard at first. The first week outside of the hospital was very challenging.
I can imagine. I can imagine. But those are wonderful words of encouragement to end on and, motivational. You're doing wonderful work. And been a pleasure to hear about your own experiences, practical information that our viewers can take from our discussion here today. I think it's been very helpful and informative. And I appreciate you taking the time out of your busy schedule to have discussion for our culture focused viewers on health and coronavirus series here. So thank you again so much. And continued blessings to you and your family.
Thank you. And if any of you guys have any questions about anything as far as treatment, what you should be doing, if you have a family member or anything, you can message me on my Instagram and I'll get back to you. It's Laquan, Quawn, James, James. And if you send me a message, I'll make sure I'll get back to you, okay?
Thank you. Thank you so much.
You're welcome.
Appreciate it.
You're welcome. Have a good day.
Thank you. Thank you.
Okay.
Thank you.